You're watching the Wellness Hour, news that makes you healthier. I'm Randy Iris. Today's topic, replacing missing teeth with dental implants. We've had him on the program before. He is New Jersey's go-to implant dentist. We have Dr. Jonathan Abenaim. Dr. Abenaim, welcome to the program.
Thank you so much for having me today.
We've had you on the program before, and amazing photos. You brought even more photos today.
Yeah.
So now for people that don't know your practice, who's your typical patient?
So the typical implant patient is that we divide it into two different categories. Number one, the patient that's been wearing dentures for 6 months, a year, maybe 10, even 20 years.
Okay.
So we look at those patients. And then the other patient is they're on their way to dentures. Maybe their dentist told them they need dentures. Maybe their friends told them they need dentures. They know that their teeth are not doing that great. And it's time to do something.
Now, we've had you on the program before. A lot of people watch the program, you say several times, and they come. So you see patients almost every day from the interview.
Yeah, I mean, almost every single day we get a patient that comes in, maybe multiple patients, and they say, Jonathan, I've been watching you for months, and I had the courage to finally call you. I'm so happy that I'm here because you're giving me the solution nobody was able to.
Okay, good. Now you have this program where it's a fast way to get dental implants, a new set of teeth. You call it the XCELL. You're the inventor of this XCELL. You teach dentists across the country this protocol. Tell me about that.
Yeah, so, we know that dentistry is not the funnest thing in the world to get to. So I wanted to invent something to be able to make our patients get to where they need to be with their smile, with their chewing, with the way they feel about themselves as quickly as possible, as minimally what we call disruptive as possible.
Okay.
To really help them get there. And I created this process, me and my team, and we're able to get them to where they need to be as fast as 3 visits, sometimes as fast as 3 weeks.
Okay, interesting. Now, you brought us a stack of photos, so we're going to try to get to as many of those as possible. But, we're in the green room and you're saying this really, and I'm paraphrasing slightly, but this really changes people's lives.
Yeah,
really?
It's, well, listen, we help them change their life. There is something about them that's holding them back. Sometimes we think it's maybe their weight, maybe the way they look, but really sometimes just their teeth. They don't get to eat the way they want to eat. They don't get to smile the way they want. They don't get to chew the way they want. They don't get to go out places where they want to go. And this really allows them to be their best self. And I'm just so excited to be able to give this to them.
Now, are there that many denture wearers or people that are headed for dentures in New Jersey?
Listen, in New Jersey we have MetLife Stadium.
Okay.
If I had to fill MetLife stadiums with the amount of patients that need it, I could fill it 3 to 4 times over. People need it because the dentistry that they've had or the dentistry that they thought they needed is just not working out for them. They don't feel the way they're supposed to feel, and that's what we help them do.
Okay, now this whole thing, because you mentioned earlier, or at the top of the show, that some people wearing dentures 20 years come to you. Now, but isn't it true if you've been wearing a denture that long, you can't do this because you don't have enough bone?
It's interesting that you actually say that. A lot of dentists believe that. They told their patients come in, they say, doctor, I can't wear this plate anymore. I need a better option. And the dentist says, listen, you got no bone. It's been 20 years. We can't help you. Well, we've developed something for them. Everybody's a candidate. If you're able to get in the car and drive to my office, you're a candidate. I can help you. And not just with snap in, snap out. I can give you permanent teeth that day that you walk out with.
Now, is this true too? I'm going to put you on the spot. That people could have literally on the day of the procedure, they could walk in with no teeth and walk out with teeth upper and lower that don't come in and out. Brand new set.
Brand new set. That's my digital process.
Is that rare?
This is our process. This is our commitment to our patients. You come in with a denture, or you come in with broken teeth, or you come in with unhealthy teeth, you walk out healthy. We do this for you. People walk out with permanent teeth the same day.
Okay, good. And people are finding it, because look, Medicaid, Medicare, really doesn't cover this procedure, but you say people are financing this every single day.
Yeah, 90% of our patients finance it. We help you through the process. My team will sit down with you, they'll discuss everything with you, and we'll find a budget that actually makes you able to get this treatment for you.
So it's not like you're carrying the loan yourself. These are, you have to have decent credit to get this done.
Yeah, we have third parties that allows you to get this done, and even if you don't have decent credit, you have a co-signer to help you get this done. It's all there. You just have a will. If there's a will, there's a way. So listen, Randy, you asked me a question before, and I told you that I change people's lives with their help. And you were skeptical. You said, Jonathan, you can't really do it. It's just teeth.
I said that in the green room.
Yeah, so I'm going to show you cases. I'm going to show you patients that, according to them, we've changed their lives. That they feel better about themselves.
Okay.
They look better. And let the pictures do all the talking. How's
Okay,
that?
okay.
Here we go.
Let's take a look. What are we looking at?
Okay, so here's my first patient. She came in. You can see she's a beautiful lady, and she's young. And she went to her dentist, and her dentist told her, you have gum disease. You're going to be wearing a denture. She was smart enough to...
She seems very young to be...
She's young, yeah, she's young, and unfortunately she had gum disease and she couldn't get away from it. But her dentist told her, you're gonna wear a denture. And she said to herself, there's no way I'm gonna wear a denture. She did some research, she found us, and look at what she looks like now.
Wow, so she would have been wearing a denture.
She's never worn a denture. She never walked out of my office with a denture. She always had permanent, beautiful teeth.
Looks very nice.
Yeah, I'm blessed to be able to do that. Listen, when we give them their teeth, that first day, it's so much emotion because people have been thinking about this forever. They've been saying to themselves, nah, I don't deserve this. No, I'm okay with this. When we give them the mirror and they see their smile, it changes them.
Do they get choked up?
They get choked up, but it's like a click. Something happens inside of them.
Really?
We see them in 2 weeks to take a look at them. Their hair looks better. Their makeup looks better. Their swagger looks better. Everything about them changes. Their health gets better. They just feel great.
How old can you be to do this? Like, what are some of the older patients?
I have the perfect case for you that comes to mind.
Okay.
So, patients say to me, I'm a little bit too old. I don't need to do this. I'm gonna die. Or I'm 60, I'm 50. I don't really need to do this. Let me show you this patient. This patient is 90 years old.
Wow.
This patient came in to see me and she said, I'm tired of living the way that I'm living. And I said to her, why do you want to do this? She said, Jonathan, even if I live for 2 more years, I want it to be the best 2 years of my life.
Okay. Does she want to eat? Like, what's her biggest complaint?
She was sub 100 pounds. She wasn't healthy. She wasn't able to consume the foods that kept her alive. That made her feel good. She came in with her daughter, and her daughter said, my mom needs to eat. She can't eat. Obviously, to look good is also great.
Yeah.
In one afternoon, Randy, I took out her broken teeth, I placed the implants, and she walked out with a brand new set of teeth.
Looking like
brand
this.
New, looking unbelievable.
So a 90-year-old, they're not, I mean, statistically, they're not more likely to fall out at 90?
No, they're actually very healthy.
Okay.
These patients are healthy. Like I said, you get in the car, you come in, you're healthy. I can help you.
How soon could she eat? Like, if everything works out right, how soon could a person like this eat?
Time she gets home, she feels great. She's ready to eat. As the implants get stronger and stronger, she eats more and more food and stronger foods, and she feels great. But let me tell you something. People say to me, hey, I'm too old. I can't get this done. I show them Joan.
Like
Joan
70, 80 is not old at all anymore.
It's perfect time. It's time for you to take over, to be able to say, I'm tired of this. I'm tired of my status quo. I'm tired of being the way I'm tired of taking my denture out at night. I want to feel great. I want to be able to just go to the restaurant, pick whatever I want to eat, go out with my friends, and not think about, I got to bring my glue to cement my teeth in. But let me show you this next patient. This one is another great one. So this is a patient. His name is Richard.
Okay.
He's a professional football player, and he had everything accessible to him. He came in, he's big, he's tall, he has a big presence, but he had something that was holding him back. You can say, well, maybe he's getting a little older, a little bit smaller, but I knew deep down this person was a beautiful person. Look at what he did. He waited till he was in his 70s.
Okay.
He came in one afternoon. We put in his implants. He walked out with a beautiful smile. Now look at it. Look at how amazing he looks. And let me tell you something. When he comes in every 3 to 4 months to maintain his teeth, I hear him from the other side of the office laughing. He always has a big, bright smile on his face. It's amazing. It's rewarding that I could do this for these patients.
So what do they like more? Do they like the fact that they can eat, or do they like the way it looks?
It's funny. There's 2 types of people that come in, and they say to me, Jonathan, I don't care what my teeth look like. I just want to be able to chew. But I say to them, as an extra bonus, I'll make your teeth look great.
Okay.
Because everything comes together. If your teeth can't come together correctly, they probably won't look good. And if they look good, they may not come together correctly. So we make both of those things happen for you. Chew well, feel great, and smile. Because let me tell you something. You know what happens? The people that say, well, I just want to chew. Someone gives them a compliment and say, hey, you look great. What'd you do? They don't always say they had dental implants. They said, nah, I got a haircut. But they know deep down it was worth it. Now
so
they got
start
that validation.
Smiling more and more compliments.
They just feel great. They buy new clothes. Their swagger changes. I'm telling you, these people are like new people. They're reborn. They're rejuvenated. It's unbelievable how something like this can do for them.
Now, your center in New Jersey. So I guess how implants are typically done, you go to one place that does like the imaging, another place where the surgeon does the implants, and then another doctor that puts the teeth on top. You do it all right there. That's what this XCELL program is.
So this XCELL process.
But aside from convenience, what's the big deal about it?
Convenience is a big deal. You know, we allow our patients to not have to go meet multiple staff, multiple doctors, and be given the runaround. They come in, they meet me, Jonathan Abenaim.
Is that right? So you still aren't too busy, you do the consults?
No, I do the consults. I not only do the surgery, I make your teeth, I fabricate your teeth in my center.
So you have like a what do they call them? Labs right there in your office.
Yes,
that makes the teeth.
Yeah, but there's no like lab. I'm the person that sits and I hand paint every single one of these teeth that you're seeing on TV. I hand painted them.
Really?
I created them.
I didn't know that.
Yeah.
Were you doing that the last time you were on the program?
No, this is something that we've been doing for our patients because we're not connected to the teeth. When I meet the patient the first time, I get to know exactly what they want. What is their goals? I'm able to take a paintbrush and show what they wanted, what they said to me on the day of the consult. This is what I want in my mouth. And able to create that specifically for them. It's dental art. We're able to put this for them so that they can chew and smile great.
You love this.
It's my passion. It's my life's work. I've spent my whole life to be able to create this for my patients. Because dentistry is not fun, but this is so easy for them. They just come in, they sit down, we take a digital camera, we do our surgery very well, we make our surgery just so precise that there's no questions. There's no more, didn't work out the way I wanted it to.
So it's kind of like one doctor, one price, all done right there.
All done right there. And it's predictable for our patients. Okay, let me just show you one other patient. This is just so unbelievable. So here's this one patient. This is Vicky. Vicky, I'll never forget. Vicky came in, we said to her, can you smile? She didn't know how to smile. As we started talking to her, she said, I've been to a neurologist because I think that something's wrong with me. And I said, what do you mean? She's like, I can't smile. Her brain has now conditioned her to say, you can't smile. The muscles of her face don't work. She can't smile correctly.
Or she feels very uncomfortable if she does smile.
Correct.
Okay.
We went ahead, we took out her infected teeth, we took out all the disease that she had, and then we went ahead, we rejuvenated her smile with dental implants. And look at her now.
Very nice.
She can't stop smiling. All she does is say, thank you, Dr. Jonathan. But I really want to say to her, thank you. Thank you for letting me do this for you, because this is just, it's amazing. It's why I got into this.
Do you get recognized on the street now? Because I mean, you're busy in New Jersey. Do people ever say, I've seen you? How do I know you? Because you're a lot on television.
Yeah, I mean, I'm a pretty shy person as it is. So when people stop me, I sort of blush. But yeah, they say, oh, you're Dr. Jonathan. I saw you on TV. And I said,
Did they ever ask about me when they see you?
Randy, you? Come on. No.
Okay, good. They don't ask. Well, if they do, you could say something nice about it.
Absolutely.
Time for a few more. What else are we looking at?
All right, let's do this
Very
one.
nice.
Let's do this one. This is Maria. Maria came in. She was told also she's going to be wearing dentures for the rest of her life. She had gum disease. You can see that there's something about her that she's dying to smile. She's dying to feel a specific way. But look at the difference. Look of where she's at. It just brightens everything up.
I think anybody looking at this would agree. I mean, she becomes more attractive. It doesn't look like the same person. She even looks more sophisticated, like more refined and educated.
But to me, her after is who she really is. It's not like I created a new person. The before is the person that she had become. But the person she really was is on the left. But let me tell you something that was interesting. She went home and her husband said, hey, that's not fair. I also want to get the same thing. Let me show you her husband.
Okay. So husbands and wives it's very common that they're coming in together?
What happens is that actually the husband or the wife come in first. They sort of, whoever's the more bravest, they want to see, is this for real? I saw this on TV. I've heard about this. It can't be real. So she gets this done. She feels great. She's dancing around the house. She feels unbelievable. And the husband says, hey, what's going on? I haven't seen my wife like this in so many years. Maybe I should have the same thing done.
Okay.
Well, here you go. This is her husband.
Oh my God.
He had this done.
The before is terrible. I mean, is that really common to see something this dramatic?
It's, what happens is people sort of get used to where they're at and they don't know anymore because they don't go to the dentist because of fear, because of time, because of money. And they say, I can't get this done. The spouse goes in, they see what's possible, and they know it's finally real, and then they get it done.
So on the consult, do they ever come in, let's say they've seen a lecture, or they've seen your YouTube, or seen you on TV, are they still skeptical sometimes? Like, that it can happen for them is, I guess, what I'm asking.
Yeah, especially the patients that have seen it 3-4 times. They've seen the program so many times, and they said, this just can't be real. But you know what? Let me come in, consult's free. Let me see what he has to say. I had a patient the other day. He said to me, I'm skeptical. I'm skeptical. I'm Mr. Skeptical. And I said, that's okay. I guarantee you're not going to be skeptical when I'm done with you. We did his surgery, and we gave him a brand new set of teeth in one day. 24 hours later, he called back and goes, I'm not skeptical. Thank you for changing my life.
Well, that's nice.
Yes. And I just want to get into it. Here, another one. I want to show you another husband and wife.
All right.
The husband went first in this case, and then the wife went right after. And his wife came in and said, I just want you to do what you did for my husband. And, it rejuvenates relationships.
So these are both people that would have been wearing dentures.
100%. Some of them are wearing dentures, and they said this is enough.
And these aren't the snap in, snap out kind of teeth. These are teeth.
These are permanent teeth.
Okay.
They're not just screwed in dentures. These are permanent teeth. They're zirconia. They're beautiful. They're translucent. They look like natural teeth. So nobody will ever say to you, hey, look at those implants. They look great. They'll say, what'd you do? You look so good. Did you go on vacation? Did you have a haircut? They'll never know, because what we believe in, our patients are beautiful frames. They're just beautiful frames. We have to go ahead and put their picture in. And the picture is the teeth. We make them straight. We make them in harmony with your eyes, in harmony with your lips. We don't give you, people say, don't give me horse teeth. I want beautiful teeth.
Okay.
So with my digital process, everything is based off of your smile, off of the proportions of your face. And because it's so digital, because it's so high tech, it's done so quickly. It's done so quickly and so.
Is that right? You actually kind of pre-plan the surgery on a computer?
Everything is pre-planned digitally. Everything is done on a computer. We take a picture of your face. We take a picture of your teeth. And no more molds, none of that stuff that, people are like, I can't deal with that. Everything is digital. This is part of my invention. This is how we allow our patients to get what they've always wanted. Just think it's not acceptable. It didn't exist.
Now, people need to know, look, this is a real interview. I'm not trying to endorse you on this program, okay? But in the green room, it's hard to say, I think we're doing it better than anybody else, but you actually are one of the guys that actually thinks what you're doing is so unique. You're doing it better, faster than just about anybody else. Is that fair to say? You believe that?
I truly believe that, because our concept is really to recreate and enhance nature.
And you like more implants, by the way. I'm sorry to interrupt you, but you like a little bit more implants than typically done.
So I know a lot of centers, they come in, they may not tell their patient, they cut a lot of bone, and then they give them bolt-in dentures. We don't want to do that. We really want to recreate your smile the way that it was, or make it a little bit better. We really save as much tissue, as much bone as we can. We place as many implants as possible, and we don't charge more for it.
But you're only talking about 6 implants, right? To give them a full arch of teeth, usually.
6 implants, 8 implants, whatever the size. A 6'5" guy is not going to get what a 5'2" woman is going to get. Everything is customized exactly for you, so that you have your teeth. So here's the thing: we want these to last you for as long as you live. So we over-engineer every single case we do, so that you never have to worry about it. And when you're all done, you're into our system, you're into our maintenance program. We see you routinely, have your teeth cleaned.
So just like your own teeth, you just go to the dentist a couple times a year?
Even better.
Better, because there's no cavities, I guess.
And it doesn't hurt. It just looks great all the time.
Now, we're short on time, and so I don't mean to rush you, but we'll try to get as many of the photos in as possible.
I really want to show you this one.
All right.
This one is a big deal. This patient comes in, I want you to take a look at her. She's unbelievable. You look at her, she's happy, she smiles. But she said to me, Jonathan, I travel all over the world. I want to feel great. I meet people all the time. There's something that's missing, and it's my smile. What can you do for me? Because everybody told me they can't help me.
What do you mean they can't help her?
They gotta wear braces, I gotta get some fillings. Old school dentistry, I just don't want. I wanna look rejuvenated. I wanna look great. Take a look at this.
It's very nice.
It's just.
Are these like porcelain veneers?
She has a combination of veneers, implants, all of that stuff, the whole gamut, everything with my process, so that it was easy for her. She was done in 3 weeks.
Very nice.
Unbelievable.
So somebody watching this right now, 3 weeks from now, you get a brand new set of teeth.
Done.
If it all works out properly.
Absolutely.
Good.
So now I want to show you, the next set of people I want to show you is just people that have had dentures. Unfortunately, they didn't find me in time. Their dentist pulled their teeth, they got dentures. You know what happens when they got their dentures?
What?
They don't wear them. They come to my practice and they say to me, I'm a denture wearer, but I don't have a denture. Please help me.
Really? So they have dentures, they just don't wear them?
They just don't wear them. And it's so common. They say they don't fit right, they move all over the place. It's just not what I want. I can't deal with it. I'd rather just gum my food.
Okay.
This, we have the ability to change them. So,
Wow.
so this guy can go from not having any teeth to having this beautiful smile and being able to chew, being able to eat, being able to talk, being able to say the way he feels because his newfound confidence. It just looks unbelievable.
Okay.
Here's another patient, and she walks in, she's like this. Her hair is not the way she wants it to be. She's trying to just camouflage. She doesn't wear her denture, and she talks to people every single day.
With no teeth in her mouth.
No teeth, but she talks with her mouth over her hand over her mouth.
Okay.
And she really wants to feel great. She said, just help me, Jonathan. Just help me get to where I need to be. And this is what my process can do for them. What I really want you to look at is look at the before and after.
Okay.
You will never even know it's the same person. Maybe that's even her
true.
daughter now.
Yeah, yeah.
And it's the way she feels. She comes in, she has makeup, she's on time for her appointments, she's excited to finally come to the dentist. Can you imagine that? To be able to say, I can't wait to see my dentist to make sure my teeth look great. And they just want to maintain it.
Now, on the consult, when they're telling you their hard luck story, do you ever kind of look at them and go, like, get kind of excited where you're thinking they have no idea how good this could be? Does that happen? Like in your mind?
You know, what I have the ability to do with me and my team is that we can see something, we can see a patient, and we know exactly what they're going to look like after. So sort of like the decibels in our voice goes up because we're just so excited. I have when my treatment coordinator calls me in, she's like all giddy and excited, and the patient doesn't understand. Say, what's going on here? I'm like, do you see how excited she is for you? Because she knows we've done so many cases just like yours that we'll go ahead and we know what you're going to look like. Let me show you some cases that we've done. I want to show you just this patient.
All right.
This patient comes in, okay? Look at his before.
Okay. Doesn't look like a happy guy.
It doesn't look like he's happy. And you may say, well, he's grumpy. He said to me, Jonathan, help me. And I never thought that he would actually transform. I knew I would change him. But this guy's a new man. He's glowing almost.
That looks good, yeah.
He's glowing almost. It's just truly unbelievable. And this last patient, this is unbelievable. This is just great.
Okay, okay.
Because I want you to take a look at him. This is Will. If you look at his before, he's pretty happy. He's smiling. He's just a happy-go-lucky guy. But his wife brought him in. She said to him, I want something for my husband. He's happy, he's good, but I know he can do, he's tall, he's strong, he's a very good-looking guy. But you can see what we can do to these patients. We can change. All of a sudden,
that looks good. He does look good.
He's got a twinkle in his eye, and this is what I want to do for patients because they deserve this.
Do they ever tell you what they want to eat? Like, do they ever say, I just want to eat this again?
Yes, at the end of when we give them their teeth, we ask them, what's the first thing you're going to eat? Steak, hamburger, pizza. Just these are things they couldn't have before. And it just really transforms them. And I'm really blessed that these patients allow me to do this for them.
All right, so no more dentures. So we have to mention again, because we get emails about this too, that even the best dental insurance only covers a very small part. Medicare, Medicaid for sure, doesn't really cover this at all. And people are financing this. So you do it right there? Can you even do it over the phone, like a pre-qualification?
Yeah, well, patients come in. If they want to get pre-qualified, we can do it over the phone. It takes less than 5 minutes for us to know if you're actually qualified. And we have a lot of different payment plans based on your budget.
If you're in your 80s, most of these 80-year-olds have a little bit of osteoporosis or they're on a few medications, they could still do it.
Yeah, so what we do is we are doctors. We have to make sure that you're healthy. So we work with your medical doctor. We have conversations to see how we can get you healthier and how we can get you clear to be able to get this done.
So what if your gums are bad, like bad gums? Are your gums too bad to hold these implants?
Yeah,
that's my question.
So I want to show you a case. I'm so happy that you brought this in. So here's a patient that came in. His gums were bad, his teeth were bad, and then we were able to actually transform him. This patient, unbelievable person. He's happy, he's smiling, but he didn't know how to smile before. But he was told he's not a candidate. He said, you have gum disease, you got broken teeth, you don't have enough bone, we can't do it. Full set of teeth, upper and lower, implants, my process, not dentures. Pure, permanent, gorgeous looking teeth that are natural.
Looks good.
It's just unbelievable. And
so this is that common where people all the time are saying, I was told I couldn't do it.
It's very common. Not only were they told they couldn't do it, they were told that it was too expensive and it was out of their price range. They weren't given options to be able to get to where they need to be. Because of my process, I knew that not everybody can get the top.
There's only like a handful of guys or companies that could even do it this quickly. Is that fair to say?
That's correct.
Okay.
I'm teaching it around the world, so they're starting to catch up. But I can tell you that we have so many options for patients, even within the permanent teeth spectrum. They don't have to jump to the lower denture snap in, snap out. Even within the permanent option, we have options for patients that are affordable, that be able to get them to where they need to be. Because everybody deserves that, to be able to choose. So Randy, do I have time for one more?
One more.
All right, let me give you this one. So here's an unbelievable patient. She came in, she's smiling, and something's going on. She's missing a front tooth. She's a young lady. She feels great, but something's holding her back. And she said to me, Jonathan, can you help me? Because I've been told that I'm not a candidate. I've been told that it's too expensive. I've been told that it's going to take 2 years. I have to go to 3 different doctors. I have to worry about all these variables that come in. Can you help me? I said, absolutely. You're my patient. I'm going to help you and I'm going to change your life. Look at what we were able to do for her after.
Pretty smiles, very nice.
Unbelievable. She's a gorgeous lady. She comes in, we see her. She was very reserved before, but now she's open, she's smiling, she looks great. Again, I'm so blessed to be able to do this. I love it.
Now, do they get, so, I mean, you have more photos than just about anybody that I've interviewed, okay? And I told you in the green room that this says a lot about you. I mean, people must like you, obviously, if they're saying, hey, you could show my photo, an embarrassing photo in certain cases, on television.
Yeah, they're excited.
So these people have all approved that you could use them on TV.
Yeah, they're excited to show their transformation because people are proud of it. They said, look at where I was, and look, I was brave, I got it done, and now I'm not looking backwards because now the future is for me, and I'm going to live my best life possible.
Okay, good. Well, look, I'm inspired by this. I think everybody watching it, so good for you, and I'm not trying to side with you. It was a great information. They could go to your website. Can they make an appointment online?
Yeah, they can make an appointment online. They look at our website, look at our Instagram, our Facebook page, and they could see every single day we post these stories of these patients being transformed.
I follow you on Instagram. It's like every day is another patient, another,
Yeah, it's really important if you're going to pick.
How do you have time to do all this if you're doing it on your own? Just the team?
When you love what you do, it's easy. And I can tell you, when you pick your implant doctor, don't pick someone that does maybe 1 a month or 1 a year. Pick somebody that does it every single day, like it's routine, a habit.
Because you're obviously, are you that much better than when I interviewed a couple years ago, or whatever that was?
Every day is a learning curve. I always learn that every single day we're going to get better and better. Stagnation is not good for us. We want to get better every day, provide better service to our patients, better solutions. Just get there.
Final message, somebody watching this, they're either headed for dentures with bleeding gums, bad breath, loose teeth, their teeth are failing, or the denture wears. Let's say they've heard this and they're still going, I don't know, I'm too old, or it seems like a lot of pain, or what. What do you say?
Just come in for a consult. Let me show you what we could do for you. Let my team sit down with you. We're going to educate you just to show you what is possible. Then if it doesn't work out, that's okay, but it will, because I will do this for you.
All right, Doctor.
Thank you so much.
Abenaim, thank you so much for coming on the program. Great stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.